resolution. And the lower you go, the worse the frequency, the worse the resolution, but the deeper you can go. Okay? So when you're doing your carotids, that's very superficial. So you're going to want to go with the highest frequency you can use because we don't have to go very deep, right? When we're doing the heart, if you're doing it for an adult, you're going to be using a relatively low frequency because we need to go a good 10, 15, maybe even 20 centimeters in some people. Okay, so that's that transducer. Let's choose the next transducer and see what the frequency is there. So somebody can push probe and set it and see what this other one does. 10L. Let's do the 10L down at the bottom. Yep. And oh, look, it's got a carotid preset.
Okay.
Go ahead and set that. And it'll tell you what the preset is up here, carotid. And I'll show you how to make a preset. So if you're actually scanning and you say, this is as pretty as I've gotten, I really like these settings, you can create that.
So it'd be like a set, like frequency and...
Yep, the preset actually
okay.
defaults to certain frequencies,
Okay.
certain gain, brightness settings and things like that, okay? So this one defaulted to 10 megahertz. So how do you change the frequency on that to see where a range is? Oh, it's a straight 10. Okay, that's the frequency then.
Oh.
Oh, no, you went too fast. Okay, so go slower.
Oh.
Oh, okay.
So 10's the highest, is that right? 8.5, 7.5. And then it switched to harmonics.
Okay.
So again, harmonics may or may not be nice. This preset actually didn't have it on harmonics. It had it on the 10, so that's probably the ideal setting. We'll see. And when we put it on the 4S, let's see what the frequencies on those are. So probe somebody.
Got it.
And let's see what the categories say. Cardiac, yep. And
So these are all
Chomp.
pre-made from other people, right?
yes.
Sally.
So I don't know what chomps are, but let's pick the echo for exercise. All right. We'll see what it looks like in the end. So this defaulted to 15, a little more than that, 16 centimeters. And it tells you what your setting is here as well. It tells you what your frames per second is, and when you do the heart, you want really fast frames per second. That's how many times we create this picture per second, and if it's too slow, it doesn't keep up with the events of the heart.
What's
right?
considered fast?
The 70 is pretty fast.
Okay.
Okay, so you'll see the frames per second. We didn't actually check it on the linear probes, but they're probably going to be a lot slower because you're not really dealing with a lot of moving, like valves and stuff. You're just dealing with some blood flow. And this one defaulted to harmonics, which I said we usually use in the heart. It's usually a very nice image in the heart, but not always. So sometimes we can turn that off. And we turn it off by just changing the frequency until it goes away. Okay, so that one went from 2 to 3.5 on the straight imaging, and then it went to harmonics. Okay. So let's look at some of these other buttons. We're going to leave it here for right now because the buttons work the same way for every transducer. So we did the new patient. You did your transducer selection. That's the first things you're going to do, okay, depending on what your goal is, the heart or the carotids. This is your ECG line. Do you have ECG cables?
Yeah.